Hey, I'm Tim. I'm a physical therapist with Midlands Orthopaedics and Irmo. I wanted to share with you guys something that we typically look for in a squat assessment when we're looking from the front. We look at a couple of different things. One of the things I really hone in on is the knees. Do the knees stay over the toes, or whenever we squat, do the knees cave in? You don't see that as much whenever people are going down as much as you see it. People have a really good looking squat, and then whenever they come up, they let those knees cave. And oftentimes they're not recruiting, or they're not getting, they don't have adequate strength in the side of their hip, in the lateral hip. A really simple cue for that is just to simply take a good exercise band, like this blue TheraBand, just tie it up around your knees. Make sure you got a little bit of tightness in it. The loops that you can get from most of your big box stores work just fine too. And so now I have this physical cue at my knees that I have to push out against whenever I go down into my squat and whenever I come back up. So that can help clean up a lot of knee pain in the front as well. Two of the main exercises that consistently show up for what they call PFPS, patellofemoral pain syndrome, is doing your side lying hip abduction. So if I'm laying on my side, I'm going to lift out to the side, usually for about 3 sets of 10 to 15 reps. And then doing a good seated hip external rotation, where we take that band again one more time, loop it up. And the way we teach this is just take your heel to the front of your opposite knee. So now I'm having to externally rotate my thigh bone, my femur, and I'm working on the strength of the lateral hip. And a lot of times those two exercises and that little cue can clear up a lot of pain in the front of the knee when you're squatting down to pick things up, or certainly if you're squatting in the gym.